Hey natural health fans! In today's video, we will explore the 5 most commonly used medications that pose a risk to liver health, while identifying the symptoms indicative of liver damage and providing strategies to prevent and protect your liver from these adverse effects. The liver, our body's largest solid organ, is essential for maintaining life and overall health. It tirelessly detoxifies the bloodstream, aids in digestion, and replenishes energy stores, all critical functions for our survival. Additionally, the liver is integral to drug metabolism. However, certain medications can cause direct harm, leading to drug-induced liver injuries. Every single time you eat, drink, or consume medications and supplements, your liver is busy acting as a crucial filter, storing nutrients and expelling wastes. This relentless processing increases the risk of encountering harmful substances. Research consistently shows that a range of medications, including herbal remedies and dietary supplements, can all elevate the risk of liver damage. Today, we will discuss the key indicators of liver damage that warrant your attention, methods to prevent such damage, and ways to determine if the medications that you possess at home pose any risk to your liver health. First on our list is a common medication known as acetaminophen, or more commonly known as Tylenol. This very commonly used over-the-counter analgesic and antipyretic is typically safe for liver health when taken sporadically, and of course within recommended dosages. However, high doses or prolonged use of acetaminophen can lead to hepatotoxicity. A single substantial overdose of Tylenol can precipitate acute liver damage, a condition coined Tylenol overdose, which constitutes a medical emergency requiring prompt intervention. In these such cases, it is imperative to contact a poison control center or to proceed to the nearest emergency room immediately. Chronic use of Tylenol or excessive intake over time can heighten the risk of liver injury, particularly in individuals with chronic illnesses, alcohol use disorders, or pre-existing hepatic conditions. To mitigate the risk of acetaminophen-induced liver damage, just adhere to the following guidelines. Never exceed the recommended maximum daily dose of 4,000 milligrams. Abstain from alcohol consumption while taking acetaminophen. Diligently check if acetaminophen is an ingredient in other medications that you're using, including over-the-counter and prescription drugs, to avoid unintentional overdose. Be mindful that many cold and flu remedies also contain acetaminophen. This drug can generate a toxic metabolite during hepatic metabolism, which can accumulate and then cause structural liver changes, impairing the liver's function and damaging it. Drug-induced hepatitis is a condition that occurs when the liver becomes inflamed due to certain medications, oftentimes resulting from excessive or inappropriate use. Drugs like acetaminophen and nimesulide are known to significantly elevate the risk of developing acute fulminant hepatitis. Besides acetaminophen, other analgesics such as ibuprofen, commonly known as Advil, diclofenac, known as Voltaren, and indomethacin, known as Syndac, are all associated with hepatotoxicity. The liver's role in metabolizing medications is crucial for preventing drug accumulation and potential toxicity. Many medications are inactivated and subsequently eliminated from the body via feces or urine after passing through the liver. However, this metabolic process can sometimes produce toxic byproducts, posing a risk to liver health. Next up on our list is diclofenac. Marketed under brand names like Cataflam, diclofenac is a widely used anti-inflammatory medication that's very effective for relieving pain from various conditions, to include arthritis. The primary concern with diclofenac pertains to its oral form rather than topical applications. Gels, creams, and patches offer a much lower risk of liver injury because they result in significantly lower systemic absorption compared to oral intake. However, chronic daily use, especially in individuals predisposed to liver problems, can increase the risk of significant hepatic injury over time. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, are widely used medications that manage pain, inflammation, and even fever. While some are available over the counter, others, such as oral diclofenac, require a prescription. Diclofenac is particularly noted among NSAIDs for its potential to cause liver injury. This damage oftentimes manifests as abnormalities in liver function tests, which are known as LFTs, without any evident symptoms. LFTs measure liver enzyme levels, with elevated levels indicating possible liver injury. These tests are performed through blood samples collected by healthcare professionals. Although serious liver damage from diclofenac is rare, the risk is highlighted in women at higher dosages and with prolonged use, typically beyond 4 weeks of usage. Next up is clavulanate, or commonly known as amoxicillin, commonly seen as brand name Clavulin. This widely used antibiotic combination is effective against bacterial infections such as pneumonia, urinary tract infections, and sinusitis. Surprisingly, it ranks among the leading medications associated with liver damage, second only to paracetamol. The combination includes an antibiotic and clavulanate, which inhibits bacterial resistance. The liver damage is believed to occur through an allergic-type reaction, although the exact mechanism is not fully understood yet. Several other medications are frequently linked to liver injury. These include antibiotics like isoniazid, trimethoprim, also known as sulfamethoxazole, erythromycin, nitrofurantoin, and minocycline, as well as the antifungal drug ketoconazole. Next on the list are called statins. Statins such as simvastatin, atorvastatin, commonly seen as Lipitor, and rosuvastatin are globally recognized for their efficacy in managing elevated cholesterol levels and reducing cardiovascular risk. Despite their benefits, statins carry a potential risk of inducing liver injury. The mechanism underlying this risk is believed to involve the production of a toxic metabolite, or triggering an immune-mediated reaction, although precise details remain unclear still. Simvastatin, seen as brand name Zocor, is another prominent statin, which has also been associated with instances of liver injury. Typically, statin-induced liver damage is mild and reversible upon discontinuation of the medication under healthcare supervision. If mild liver enzyme elevations occur, it may still be possible to continue statin therapy with careful monitoring. In cases of significant enzyme elevation, switching to an alternative statin may be considered. While liver issues with statins are infrequent, healthcare providers oftentimes conduct liver enzyme tests before initiating treatment, or shortly thereafter as a precautionary measure. Further testing is generally unnecessary unless symptoms suggestive of liver dysfunction arise. Things such as unusual fatigue, weakness, appetite loss, upper abdominal discomfort, dark urine, or jaundice, which is the yellowing of the skin or eyes. It is crucial to promptly consult a healthcare professional if any of these symptoms manifest. Next on our list, we have amiodarone. This is a prescribed medication to manage irregular heart rhythms, but this prescription drug may elevate liver function tests, seen as LFTs, in approximately half of long-term users, usually without severe consequences. However, about 1% of individuals may experience significant liver damage. Reflecting this risk, the FDA has issued a boxed warning, its highest alert level, in order to alert patients and healthcare providers about potential liver hazards associated with this drug. Regular monitoring of liver function and ongoing communication with healthcare providers are crucial for those that are taking amiodarone. Liver injury is more prevalent among users on high doses or on prolonged treatment durations. Thankfully, this risk can be managed through vigilant monitoring, typically involving regular LFT assessments in order to gauge treatment appropriateness. Well, technically, yes, dietary supplements can potentially harm the liver. Research indicates that supplements contribute to approximately 20% of liver injury cases in the United States. Problematic supplements, and at the top of the list, are bodybuilding products containing anabolic steroids, but there are much more, like weight loss aids with green tea extract, high-dose vitamins such as niacin, especially if over 3,000 milligrams per day or for prolonged use, herbal remedies like ginseng and black cohosh, and complex nutritional supplements. Caution and consultation with healthcare providers is advised before starting any new supplement regimen, especially if those supplements involve high doses or long-term use. Now on to recognizing liver damage symptoms. The liver is remarkably resilient, but just like anything, it is susceptible to injury. It can even deteriorate rapidly, sometimes leading to acute failure within days. Symptoms oftentimes start mildly with nausea and then progress to severe abdominal pain. In more severe cases, symptoms may include coma. Early detection of liver damage symptoms is critical, such as abdominal discomforts, fever, dark urine, jaundice, which is the yellowing of skin and eyes, nausea, fatigue, rash, and pale stools. Immediate medical attention is crucial if these symptoms occur, and bringing recent medication boxes can further assist healthcare professionals in determining appropriate treatment. Liver damage can rapidly escalate to life-threatening levels without prompt intervention. Untreated cases may necessitate urgent liver transplantation or, in extreme cases, result in death. While the liver generally metabolizes drugs consistently, individual variations can lead to differing drug sensitivities and/or tolerances, affecting efficacy and safety even with identical dosages. Now, on to preventing liver damage. Follow these guidelines to mitigate the risk of liver damage or injuries. Avoid excessive use of over-the-counter medications like acetaminophen. Adhere strictly to the recommended doses on medication labels. Limit alcohol consumption, take medications precisely as prescribed, consult healthcare providers before starting new medications and/or supplements, be mindful of potential interactions between medications and supplements, and attend regular medical checkups, including LFTs if advised by your healthcare professional. Suspecting excessive medication intake and potential liver impact requires urgent medical attention. Promptly inform healthcare providers about the medications taken, the quantities, and the approximate timing. Swift action is crucial, and it can be life-saving. We trust this information has provided valuable insights into identifying and preventing medication-related liver damage. Vigilance in adhering to prescribed dosages and consulting healthcare providers about medication concerns is absolutely paramount. If you found this information beneficial, please like and subscribe for more health-related guidance. Remember, your liver's health is integral to your overall well-being, so make informed choices regarding your medication use. For any queries or concerns, feel free to leave a comment. Thanks so much for watching, and remember, prioritize your health.